Healthcare in Kosovo, Wikipedia audio. Primary healthcare. Secondary healthcare. Statistics. Tertiary healthcare. In the past, Kosovo's capabilities to develop a modern healthcare system were limited. Low GDP during 1990 worsened the situation even more. However, the establishment of the Faculty of Medicine in the University of Pristina marked a significant development in healthcare. This was also followed by launching different health clinics which enabled better conditions for professional development. Family medicine centers, ambulatory care units. Nowadays the situation has changed and healthcare system in Kosovo is organized in three sectors including primary, secondary and tertiary healthcare. Primary healthcare in Pristina is organized in 13 family medicine centers and 15 ambulatory care units. Secondary healthcare is decentralized in 7 regional hospitals. Though Pristina does not have any regional hospital and instead uses University Clinical Center of Kosovo for healthcare services. University Clinical Center of Kosovo provides its healthcare services in 12 clinics, where 642 doctors are employed. At a lower level, home services are provided for several vulnerable groups which are not able to reach healthcare premises. Kosovo healthcare services are now focused on patient safety, quality control, and assisted health. Nowadays, healthcare institutions are going through some profound reforms that target providing decentralized services and covering all community residents by health insurance packages. The Statistical Agency of Kosovo is a professional institution operating since 1948. Located in Pristina, which collects, processes and publishes official statistical data. Since 2011, this agency functions under Prime Minister's office. It is funded by the Kosovo Consolidated Budget and it is supported by donors. They have professional and technical cooperation with all ministries of Kosovo's government, especially with the Ministry of Economy and Finance, the Central Bank of Kosovo, Eurostat, International Monetary Fund, World Bank, SIDA, DFID, UNFPA, UNDP, UNICEF, and many other international institutions. According to a study made by Kosovo's Ministry of Public Administration, the number of female employees in Kosovo's health institutions has been distinctly bigger during the previous years. In 2010 there were 8,928 female employees and 4,282 males. This number had a minor increase in favor of male employees by 1% in 2012. University Clinical Center of Kosovo has had 870 doctors in a period of 2010. In 2012 this number dropped off in 642. The Department of Gynecology has had the largest number of personnel throughout the last 3 years, while neurosurgery has had the lowest. The mortality rate has had many variations. Thus in 2009 it was 836 patients in regional hospitals out of which 39% in Prizren's Regional Hospital, 21.5% in Pija, 20% in Jakova, 17.7% in Gjilan, 1.0% in Vushtrari and 0.1% in Ferizaj. However, in 2010 mortality rate slightly decreased in 806. Prizren remained the region with the largest mortality rate during these years, whereas Jakova and Pija gradually equalized. Regional hospitals. After the 1999 war, Kosovo has done some major improvements in its health care. During this period, medical services in Kosovo have received several donations and international financial support has raised dramatically. Many buildings have been constructed and renovated, the staff number expanded, and the number of patients seeking for medical services is increasing every day and more. The highest healthcare authority in the Republic of Kosovo is Ministry of Health of Kosovo. As in other countries, Kosovo's healthcare system is organized into 3 levels: primary, secondary, and tertiary healthcare. University Clinical Center of Kosovo, University Dentistry Clinical Center of Kosovo, National Institute of Public Health, Kosovo. Healthcare divisions. Primary healthcare relates to the professional healthcare services offered to the community, usually from a nurse or general practitioner. It covers a wide range of health and preventative services such as supporting and taking care equally for all community, including those who have lower income, provide health education, counseling, disease prevention, screening and promoting better living environments. Primary healthcare became a fundamental concept for World Health Organization as a result of the Alma-Ata Declaration. Since the declaration of Alma-Ata, health situation at country level has gone through major changes. There have been many modifications in demographic profiles, socio-economic environment and reducement of risk exposure and common diseases. Primary healthcare is available for individuals and families, coming from different municipalities, with affordable costs that can be covered by the government funds as well as community. Kosovo consists of an overall 36 municipalities, all of which has their own PHC medical centers. Kosovo primary healthcare is organized in 2 separate levels such as family medicine centers and ambulatory healthcare units. Geographically isolated municipalities have established also some maternities, such as women welfare centers, that serve for women emergency well-being cases. The table below shows main family medicine centers in Pristina and their locations. The table below shows ambulatory medical units in Pristina and their locations. Lack of family medicine specialists. Family health care centers in Kosovo are in need of 1,000 family medical specialists. Currently there are approximately 500 family doctors providing primary health care services. Primary medical centers usually deal with problems such as short data on citizen registry, incorrect addresses, and a large number of community migration from rural to urban territories. Recently, the Ministry of Health has signed an agreement with British College to train Kosovo graduated doctors in UK. Secondary healthcare refers to a higher level of healthcare system, in which patients from primary healthcare are referred for more specialized treatments. Secondary healthcare level includes medical services provided by a specialist or more advanced facilities, upon referral from a primary care physician that requires more specialized knowledge, skill, or equipment than the primary care physician. Secondary prevention programs identify and treat asymptomatic people, who have already been exposed to different risk factors or have any preclinical diseases, without any clinical symptom. These activities are focused on early screening of asymptomatic patients, that are prone to develop the disease without any possible prevention or treatment. Screening tests are an example of secondary prevention activities, since they are performed even on patients who did not manifest any clinical symptoms of diseases, such as hyperlipidemia, hypertension, breast, prostate cancer, and many others. Secondary healthcare is offered by regional hospitals in municipalities such as Mitrovica, Peć, Jakov, Prizren, and Gjilan. Besides University Clinical Center of Kosovo, which is the only tertiary healthcare center, there are also 7 regional hospitals that offer secondary healthcare services. Most of referred patients to UCCK come from regional hospitals. Regional hospitals in Kosovo are primary health care, family medicine centers. Tertiary healthcare is the highest specialized medical level, which offers more complex procedures and treatments performed by specialists. Tertiary activities involve treatment of already established diseases, manages to restore patients to their highest functional level, minimizes negative effects of disease and further complications. Prizren's Regional Hospital, Peč's Regional Hospital, Jakova's Regional Hospital, Ferizaj's Regional Hospital, Gjilan's Regional Hospital, Mitrovica's Regional Hospital, Vushteri's Regional Hospital. Ambulatory medical units. Secondary health care. Regional hospitals. Tertiary health care. University Clinical Center of Kosovo. Kosovo's tertiary healthcare specialized medical services are offered by medical institutions such as University Clinical Center of Kosovo, University Dentistry Clinical Center of Kosovo, National Blood Transfusion Center, National Institute of Labor Medicine, Medical Center for Sport and Recreation, National Institute of Public Health and Faculty of Medicine, University of Pristina. Many tertiary healthcare services are mistakenly used instead of primary and secondary healthcare services from Kosovo inhabitants. Overall satisfaction with healthcare institutions. University Clinical Center of Kosovo is the main tertiary healthcare institution located in Pristina, which offers most specialized medical services. It consists of Emergency Care Center, 12 clinics, National Institute of Public Health, Central Pharmacy, private pharmacies, and institutes like Anatomy, Pathology, Physiology, Pharmacology and Toxicology. Costs of medical treatments. UCCK clinics, human resources. Doctors' performance. National Institute of Public Health in Kosovo. This table shows the overall human resources working in University Clinical Center of Kosovo, including specialized doctors and nurses for 12 clinics, Emergency Care Unit, National Institute of Public Health Kosovo and Central Pharmacy. National Institute of Public Health was established on June 5, 1925, and it is the highest medical, professional, and scientific institution. The institution organizes and applies the strategy of public health, health promotion, water, food and air quality controls, health policy, economy of health, and develops scientific research works in the territory of the Republic of Kosovo. Hence, the institute is known as the educational base of the Faculty of Medicine and is divided in 5 departments: epidemiology, human ecology, social medicine, microbiology, and health information system, Kosovo School of Public Health. Development history of NIPH. The 20s of the last century are characterized by very bad medical conditions in the Balkans. In general, based on the Kosovar healthcare condition and the overall public health situation, a decision was made to establish hygiene and epidemiological services in the city of Peć with the Rockefeller Fund support from the U.S., and on June 5, 1925 this service finally began to work. On the same day, bases were set for preventive medicine in Kosovo, and June 5 is marked as a festive day for founding of the Institute of Public Health. After that date, sanitary stations, hygienic and microbiological or epidemiological services were established in Pristina, Prizren, and Mitrovica. In these units there was a great lack of specialized staff, but health services were performed by health employees with medical school degrees. In ancient Prizren, during 1923–1924, it was established the highly efficient bacteriological service which provided services to the entire territory of Kosovo at that time. Yet, Dr. Isa of Dedushaj stated that it was only bacteriological service which later developed into the hygienic sanitary services in order to be later transformed into the Regional Institute of Public Health of Prizren. During the years 1946–1947, the first Albanian doctor Dr. Dimish Salina started his work by developing educational medical activities. At that time, Dr. Daut Mustafa lectured professional courses in the medical high school too. The inheritance of many infectious diseases had damaged the country in terms of economy, culture, education, and health. Prior to World War II and especially after it ended, the health condition and the circumstances in Kosovo were extremely difficult. There were many serious infectious diseases such as malaria, typhus, louse, tuberculosis, measles, meningitis, diphtheria, and other diseases which led to killing hundreds to thousands infants. It is important to emphasize the fact that in Kosovo in 1940 there were 5 hospitals with 390 beds, 36 different ambulatory medical and preventive services that had 5 sanitary epidemiological stations, from which only 3 had worked. Dr. Isa of Dedushaj stated that in all these medical institutions there were 38 doctors, 20 private pharmacists, 1 dentist, and around 85 medical workers that have learned from medical practice and courses offered at that time. After World War II, Kosovo had terrible living conditions and the illiteracy rate was about 98%. In the early 1946, Kosovo had 5 hospitals with 333 beds, on average 0.4 beds per 1,000 inhabitants, 9 doctors, 15 pharmacists, 6 medical technicians, 11 cleaners, and 27 other medical workers with lower qualification. The medical protection was offered in 8 cities, 3 villages, and 1 anti-tuberculosis dispensary, whereas in the dental prevention program there were 4 dentists. University Dentistry Clinical Center is located in Pristina and it is the main medical, educational, and scientific institution in the field of dentistry in Kosovo, and their mission is to maintain and develop good oral health. Their staff participates in different local and international meetings, training, professional and scientific conferences. The outcome of these activities is primarily increasing the efficiency of the dental procedures in order to maintain with the contemporary developments in dentistry. The application of the Health Information System in UDC endorsed their work in developing in terms of dental medicine, since it provides reliable data, in collaboration with the Ministry of Health in Kosovo, to establish dental medicine welfare in general. University Dentistry Clinical Center. Development history of UDC. The history of Kosovo dental medicine began with the practical training in the Laboratory of Medical High School in Pristina. At that time, dentistry section was established where 96 dentists worked. The section of dentistry was organized in independent working units and they were Prosthetic Dental Clinic, Tooth Disease Clinic, Mouth Disease Clinic, preventive dentistry clinic, oral surgery, teeth, and X-ray laboratory and working community. In dentistry section there were 177 employers, 44 doctors, 20 assistants, 9 trainee assistants, 29 dental technicians, 50 medical technician, 15 administrative staff and 32 support staff. The educational and health activities were mainly conducted in the charitable humanitarian organization Mother Teresa in Pristina. Since June 1999, dentistry clinics became part of the UDC until November 2003, when an important event for dentistry occurred when the Ministry of Health issued an administrative instruction December 2003, on the establishment of UDC as an autonomous and independent institution from University Clinical Center of Kosovo. Perceptions on presence of corruption on health care. Private registered dentistry clinics. Based on the publications of Ministry of Health in Kosovo, there are only 248 licensed private dental clinics, even though there are around 921 registered dental clinics through Kosovo. Constructing legal infrastructure, then creating health insurance law, offering a basic package for all Kosovo inhabitants, offering qualitative services, creating and maintaining regional network with other states, learning from their experiences. Licensed private hospitals in Kosovo are the following: Special Hospital for Cardiovascular Diseases Intermed, Specialized Hospital for Cardiovascular Diseases International Medicine Hospital, and Cabinet Coronarography Diagnostica. Private hospitals. University of Pristina, Faculty of Medicine. Regulation and oversight. American Hospital is a private hospital in Pristina inaugurated on April 6, 2012. American Hospital in Kosovo is a Bedminster Capital Management Fund investment, based in New York, whose participants are the government of the United States of America. It is represented by the Office of Foreign Investment, the European Bank for Reconstruction and Development and different American investors. It has an area of 3,000 square meters, 4 floors, 30 hospital beds, 3 surgery rooms, 2 maternity rooms, 2 suites with advanced equipment and about 100 employees available to provide professional medical services. It is 24/7 open. There are many services offered including gastroenterology, cardiology, neonatology, neurology, pathology, pediatrics, urology, and different types of surgeries. Bosisi, Kosovo IVF Center and Specialty Hospital was founded in Pristina in 2010. It is opened every day of the week, 24 hours a day. It is located on a 26,900 square foot lot with a modern architecture inside and out. Bosisi contains an IVF center, polyclinic, embryology laboratory, 3 operating rooms, neonatal intensive care units, delivery room, and 10 patient beds. All of the rooms are equipped with the latest technology. EDA Heart Hospital is the first interventional cardiology hospital in Kosovo. It was established in 2007, and provides diagnostic services and professional treatment related to cardiology. Many of the newest treatments for coronary heart disease are performed within Heart Hospital EDA through minimally invasive techniques using catheters, balloons, and stents. There are also some non-surgical procedures performed such as catheterization, balloon angioplasty, intravascular ultrasound, coronary artery stenting, ECG monitoring, and echo monitoring. Their doctors are currently participating at the worldwide ongoing trial called Valentine, which is used for treatment of restenosis of coronary arteries. This is a breakthrough for Kosovo's medicine and the first time participation in such kind of initiatives. International Medicine Hospital is an international medicine hospital group branch from Turkey. The hospital has 45 beds, out of which they have 18 beds in intensive care, 6 in cardiac rooms and 11 in interventional cardiology, which is divided into 3 spaces. German Eye Clinic is a specialized eye clinic, equipped with modern instruments for examinations and treatment of common eye diseases. Their services include intraocular implants, laser eye surgery, cataract surgery, retinal surgery, glaucoma surgery, squint surgery, etc. Their professional team consists of 7 eye specialists, 1 anesthesiologist, 1 anesthetist, and 8 nurses. University of Pristina was founded on June 17, 1969, though it started working on December that year. First lectures were held in the philosophic department of the university. Faculty of Medicine consists of 6 departments such as general medicine, pharmacy, physiotherapy, dentistry, and nursery. The general medicine and dentistry studies last 6 years, pharmacy lasts 5 years, whereas physiotherapy and nursery last 3 years. Initially, the Faculty of Medicine in Pristina started off with only general medicine, but 6 years later the section of dentistry was founded. On May 15, 1996 the pharmacy section was founded, and later on in 2001 the physiotherapy was founded as well. Nowadays Faculty of Medicine, University of Pristina is an integral part of University Clinical Center of Kosovo. Departments, students. About 1,985 students attend medical lectures every year. The actual Minister of Health, Professor Dr. Farid Agani, stated that Faculty of Medicine is looking forward to become an independent part of University of Pristina, and the whole idea is to create biomedical university whose rector will be a doctor, and the 6 departments of Faculty of Medicine will be transferred to the biomedical university. If established, the medical science faculty will be the 3rd public university in Kosovo, right after University of Pristina and University of Prizren. The Ministry of Health operates under the Government of Kosovo in accordance with its constitution and applicable laws. The Government of Kosovo is composed by the Prime Minister, Vice Prime Ministers, and Ministers. It is located in the center of the capital of Kosovo, Pristina. The work of Ministry of Health is organized through the Department of Finance and General Services, Legal Department, Department for Health Information Systems, Department for Health Services, Department for European Integration and Policy Coordination, Department for Strategic Health Development and Department for Health Services in Prisons. The Ministry of Health is responsible, among others, to draft policies and ensure law implementation, promote non-discrimination approach on healthcare system, sets norms and standards respecting relevant international health standards. The Ministry of Health coordinates activities in the health sector including environment protection. Kosovo healthcare functions based on the following principles: equity, quality, equal treatment, sustainable financial conditions, cost-efficient services. Department of Health and Social Welfare. According to the local government laws, the Department of Health and Social Welfare creates strategies for primary health care, diagnosis, and basic health care, including minor surgeries, oral health promotion and basic dental care, quality assurance of food and water, ensuring the provision of social services and families within its territory, through the activities of the Center for Social Work or by providing financial or other assistance to non-governmental organizations dealing with this activity. The table below shows human resources working in public healthcare institutions in Kosovo, compared to other countries, based on health sector strategy provided from Ministry of Health Kosovo. Different national and international reports have shown that Kosovo inhabitants are very unsatisfied with healthcare services offered, and corruption is prevalent and a persistent challenge for health sector, though such conclusions were reached without in-depth analyses. UNDP committed on designing Public Pulse report, to conduct more in-depth analyses around perceptions of corruption in health sector, and measure patient satisfaction with healthcare services in Kosovo. Public Pulse report recruited a sample of 1,334 patients, who were treated in public healthcare institutions around Kosovo. Results showed that patients are highly satisfied with healthcare services offered, due to the fact that more than 70% answered to be satisfied or very satisfied with the healthcare services, personnel, and support they received in the healthcare institutions. Meanwhile, corruption was shown to be less prevalent than reported in other studies. Only 4% of respondents solicited for a bribe during their most recent visit in public healthcare centers. Results of Public Pulse report indicate that respondents were generally satisfied with healthcare services offered in family medicine centers, regional hospitals, and University Clinical Center of Kosovo. The highest dissatisfaction was shown with University Clinical Center performance. Almost 30% of respondents were unsatisfied with treatment offered. On the other hand, 70% were satisfied or highly satisfied. Additionally, 25% of patients treated on regional hospitals and family medicine centers were unsatisfied or very unsatisfied with healthcare services, while only 15% of patients treated on private clinics were unsatisfied. Meanwhile, patients who visited pharmacies expressed high satisfaction with services obtained. 86% were satisfied. Therefore, the most satisfied patients were the ones who received services in pharmacies and private healthcare institutions, followed by patients who were treated in regional hospitals and family medicine centers. Majority of Public Pulse report respondents declared that they did not pay for services offered in public healthcare institutions. Only 666 respondents out of 1,334 paid for healthcare services provided. Patients coming from rural areas approximately pay 50 to 200 euros to travel to their closest medical center, which still remains one of the most concerning problems of Kosovo healthcare system. Public Pulse report respondents were mostly concerned of the short time doctors spent with them, and their involvement in decision-making was very low. The strongest attribute of Kosovo doctors is the respect they give to their patients, since only 225 of patients complained on that side. Corruption still remains a big challenge for public healthcare institutions. From the Public Pulse report, 52 respondents of the sample answered affirmatively, indicating that they were solicited during their last visit. On the other hand, the majority did not report such situations. Bribes are mostly used as a way to obtain easier and earlier healthcare services in public healthcare institutions. In the region of Pristina there are 116 licensed pharmacies registered. They are all licensed from Kosovo Medicines Agency and Kosovo Customs, which has the duty to control the import of pharmaceutical products and medical devices. Hence, a valid import license is required in order to import these products, and it is regulated by the Law on Medical Products and Equipment, No. 03/L188, Article 14, and other legal norms. KMA is liable to protect the health, provide quality and guaranteed medical products, equipment, and services through the licensing of professional companies and individuals, and yet regulates the production, import, and distribution of medicinal products, active substances, herbal products, dietary supplements, excipients, therapeutic dosage vitamins, medical equipment. The table below shows Kosovo healthcare budget for 2012, based on Health Statistics 2012 report prepared from Kosovo Prime Minister's Office. Health reform system has been discussed for a long time on the post-war period. 14 years after the 1999 war, year 2014 still marks serious problems in health sector, including ongoing efforts on healthcare reform and healthcare insurance law implementation. Delays on law voting process, because of some technical errors, have a direct impact on beginning of reformation process of the healthcare system. These delays on implementation are mostly happening because of the ongoing debate if the law should or should not state that public sector should be divided from the private sector of healthcare system. Healthcare specialists claim that opposition of dividing private from public sector is intended to be done by law with a purpose of undergoing the ambiguity embedded in UCCK. Recently, chambers of doctors started operating, which now immediately will lead to further progression on health reform. The Chamber of Doctors is going to be responsible in forming the ethical code and also to decentralize and carry out major responsibilities that currently are carried by Ministry of Health. In ongoing public debates on healthcare system and healthcare insurance law, some small changes are requested in favor of citizens, including also healthcare insurance coverage for every citizen of Kosovo. Health insurance through years. Healthcare sector within the last 60 years has passed through a very difficult transition period. If we go back in time, we find out that social insurance, also including health insurance packages, in Kosovo first started on 1945 based on some bylaws. During that time there were many attempts, trying to spread health insurance packages in different society categories. After some profound constitutional changes on former Yugoslavia on 1965, all inhabitants got covered by a basic health insurance package, founded by government's special fund. Starting from 70s to 90s, because of a very complicated political situation, Kosovo inhabitants were not allowed to get covered by any health insurance packages. Starting from 1999, when Kosovo finally became independent, there was a $60 million investment in health sector, though small progressions are done by now. Health insurance in recent years. Starting from 2007, Kosovo health insurance law was approved. Funds for health insurance packages were collected from personal income taxes. After a period of time, generating health insurance funds from community incomes did not prove to function in the right way, so now health insurance law is being reconsidered. Comparing Kosovo to other regional countries, we can state that Kosovo is the only regional country that still does not have an approved and functional health insurance law. Kosovo healthcare reform includes some profound changes on financial, organizational, and functional healthcare system, targeting here also the health insurance law. Kosovo Federation of Health Syndicate is fully dedicated to accomplish legal structure that is needed for further processing with health insurance law. Kosovo Federation of Health Syndicate main targets are the following. Though health insurance is an essential human right, nowadays many Kosovo inhabitants still consider health insurance as an expensive luxury privilege. Up to date, all healthcare services provided in public facilities are covered by governmental funds, distributed to the Municipal Health Directorate. Only 2% of Kosovo inhabitants are covered by private health insurance companies. Private insurance companies are organized in a joint association called the Insurance Association of Kosovo. This association was established in 2002 with the agreement of the licensed insurance companies in Kosovo. They seek to improve the insurance industry in Kosovo, to stabilize the insurance market and to offer trainings to the companies. The insurance companies in Kosovo are the following. Patients' Rights Association in Kosovo is an independent and non-profit association. Its main activities include promotion, education, public meetings, information outreach, conferences, and seminars. Albanian Health Initiative goal is to identify and eliminate healthcare inequalities that exist in the Albanian American community. This initiative promotes preventive screening measures and efficient utilized healthcare resources, in order to improve the quality of care and strengthen the patient-physician relationship. Also, a very precious member of AHI is Dr. James Strickler. Since 2000, Dr. James C. Strickler, Emeritus Professor of Medicine, Family Medicine Doctor, and former Dean of Dartmouth Medical School, has supervised the student exchange program between Dartmouth Medical School and University of Pristina, Faculty of Medicine. More than 200 students have benefited from the program. Some of the Albanian exchange students have successfully obtained ECFMC certification, who have done research for medical institutions in the United States and have joined the Albanian American Medical Society. With the ongoing effort of Dr. Strickler, Geisel Medical School has raised more than $4.5 million for the development of healthcare programs in Kosovo. Albanian Health Fund has recruited, planned, and sent small teams of medical and surgical personnel to Albania who participated in teaching and clinical interaction with Albanian specialists. The AHF main goals are continuation of tutorials on given medical specialties for the Albanian medical community, providing medical supplies and equipment, organizing medical study trips to the USA for selected Albanian doctors and many other public activities. MediGAL is the Association of Health Managers in Kosovo. It has done many activities, whereas the latest and most important activity was the Swedish donation of 350 external breast prostheses for patients with surgical mastectomy. The donation came from the Swedish association called Parlan, which was established by women who have had problems of this nature. The Ministry of Health of the Republic of Kosovo has recently signed a cooperation agreement with the Association of Kosovo Medical Health Management and Special Education Organization Özel Eğitim Kurumları İREM from Turkey, for extensive cooperation in health sector. This agreement was signed by Minister of Health, Professor Dr. Farid Agani, Dr. Cenktam Haha DMD, MBA from MediGAL and Mr. Zulfikar Aklar for İREM Özel Eğitim Kurumları. The agreement commits on helping patients to being treated in Turkey by medical specialists, if those cases cannot be treated in Kosovo. Ministry of Health, Directorate of Health, Municipality of Pristina. Public healthcare institutions, human resources compared to other countries. Healthcare system efficiency and equity. Drug efficacy and safety. Kosovo healthcare budget. Health reform. Health insurance. Private insurance companies. Medical agencies and associations.